All right, well, as you let more people in, we will get started. Let's see here. All right. Well, good evening, everyone. Thanks so much for joining us. I know that we have some more people that we're letting in, but we want to get started so that we stay on time tonight. I'm Lori Bissick. I'm the membership chair for Impact 100. And really welcome to our third education series. The goal of these virtual events are really to help us gain some perspective on the pressing needs in Monmouth County. So back in October, Mary Riley on our grants leadership team showed us the Monmouth Acts needs assessment in our county, which was actually done back in 2016 and then updated in 2020. So what we did is we kicked off our events in December with Susan Kiley, who's the Deputy Commissioner of Monmouth County. And she really discussed the Monmouth Acts program. And it was nice because Impact members and guests, really got to gain some insight into some of the needs in Monmouth County. And so what I want to do is just show you a 1-minute brief video from Commissioner Kiley in case you weren't on our first call.
Hello, my name is Sue Kiley. I'm the Deputy Director of the Monmouth County Commissioners, and I am joined today by Jeff Pursley and Mary Pat Angelini. And we are here to talk to you about Monmouth Acts, which stands for Assisting Communities Through Services. In 2016, we did a thorough survey of the county to understand what things were required by our residents. We discovered that many people had no idea the volume of services that were available to them. And from that came the Monmouth Acts organization.
In Monmouth Acts, the Department of Human Services are working in conjunction with the social service agencies that we fund to identify and improve the services that we are offering the residents of Monmouth County.
This public-private partnership is broken into 8 hubs, and we look at anything from behavioral health to housing to child care. We are constantly trying to connect our Monmouth County residents with their trusted community organizations.
In order to access the information on Monmouth Acts, go to monmouthacts.org or call into our social services office, which has a connection to all of the county resources that you can access, and I hope you take advantage of them.
Okay, so really just wanted to kick off a little bit about, Monmouth Acts. And as they said in the video, this is an innovative public-private partnership, and it's really the first of its kind in New Jersey. So what it really obviously is doing is trying to bring together some of the county employees and the community partners to better the quality of life for our Monmouth County residents. And so just a quick brief overview for those of you that might not be able to be on our last 2 calls. I think there were a few things that we learned. One is that communication is so important, right, with some of these services and everything going on in our community. So the community information sharing is one thing that they've tried to increase with Monmouth Acts. It's really designed to show the residents so they can better understand what services are available and then obviously what support is available and how to get it. And I think one thing that was evident in our past 2 calls, we had Fulfill and St. Mark's, HABCOR, and the Mental Health Association, they all talked about working with the county on a regular basis and how important the communication was. The second thing is collaboration and innovation. The county will approach the human service planning, the funding, and the service delivery in a much more holistic way through this. And obviously, they talked a lot about it being an integrated public-private partnership. Another thing we learned from our last 2 calls is that the delivery of services has been quite difficult in this time, which is something that they're trying to obviously work on. And last, discovering some unmet needs. One of the things that they were able to look at in the comprehensive planning based on the survey results. But tonight is about substance abuse, and obviously a very tough topic that many of us may be able to relate to. A key finding in the assessment was there is absolutely a growing opioid epidemic and increasing mental health challenges among our residents. So I am honored to talk tonight with Lynn Regan, Executive Director and co-founder of CFC Loud and Clear Foundation, and her son Daniel, also founder of CFC Loud and Clear Foundation, about this topic. First, I just want to give a quick congratulations to Lynn on receiving recently the Russ Berry Award for making a difference. Lynn, we know you absolutely are making a difference, and we're blown away by both of your strengths and your passion and your dedication. And we're so excited to have you on tonight. So welcome to the two of you.
Thank you.
Thank you.
Thanks for having us.
So we have a lot of questions, but something I wanted to start with, and for those of you that don't know a little bit of the background, Impact 100 awarded CFC a grant back in 2018. It was Impact's third year of awarding grants in Monmouth County, and it was just 6 years after CFC began. And many of us at Impact just absolutely remember both your stories. And I really want to share this 3-minute video with everybody because it's so impactful. Casey DeStefano made this video for us, and we are so thrilled to be able to, sorry, let me get out.
Yeah, you're doing better than I would do.
CFC was created because of our family's journey through addiction. My son, in 8th grade, I looked at his cell phone and I saw bring a perk to school. And then I said, it's Percocet. You don't think this is going to happen to you. He decided to experiment with OxyContin. He had a $320 a day habit. He started smoking crystal meth and shooting heroin. I kicked the door in. He had his arm tied off, had a spoon in his hand. He was ready to do his drugs. I didn't even recognize my son. So he was lost in the quagmire of addiction. I refuse to lose my child this way. Refuse. I didn't think I would survive the loss of him. Hell. It was hell. Hell.
My mom is an amazing woman. She is a passionate human being that I know I would not be here today without her. I say all the time that she gave birth to me twice. The second time was probably a lot harder.
From when people get out of treatment to when they come home, there's a gap. CFC has identified that gap and filled it.
This organization and our mission is solely responsible to keeping myself sober.
Our mission is to create a cornucopia of recovery. And we started compiling this aftercare program. Daniel's recovery plan. Within that year, he buried 27 friends in this area from heroin overdose. The kids that were left, that were his friends, started going, dude, how are you sober? Please help me. So they would come to my kitchen table and we would start doing Daniel's plan for Nick and for John. It was 1 kid, 2 kids, 8 kids, 10 kids.
I've been struggling with addiction for a long time. I'm trying to be a better parent for my daughter. 16 months ago, I had no hope. CFC has given her mommy back.
Impact 100 allowed us to expand.
The family support group has saved my life. There's just nothing else like it.
Since we've had the Impact 100 grant, we have grown tremendously.
Our numbers have doubled in attendance.
We established a family support group, a couples support group, grandparents support group, and a women's support group as well.
We knew that affecting the whole entire family dynamic would prove to be successful.
We couldn't have done this without the Impact 100 grant, and I am forever grateful. Drug overdoses kill over 64,000 people a year. Monmouth County ranks 4th in New Jersey. Now when we look back, over 15,000 families, it's not about Daniel anymore. It's about the whole world.
That video every time, it just gives me chills. So thank you for letting us share it again, because I think it's just such a great start to talk tonight a little bit more. So we have some questions, obviously, for Lynn and Daniel, but if you have any questions, please put them in the chat. We absolutely will be opening it up at the end for more questions. So I think first, really just to start, as we've been starting a lot of our calls, is if you could just talk about substance abuse sharing information about Monmouth County and some of the numbers across what we see.
Sure.
Want me to start?
You want to talk about Monmouth County?
Yeah. I will start about, well, we got the New Jersey CARES, drug deaths have not gone down, that's for sure. We got our information from New Jersey, the stats from New Jersey CARES.gov for 2020. And New Jersey suspected drug deaths are 3,046 in the state. Monmouth County is 180. When we look at Monmouth County, Mercer County, Middlesex County, and Ocean County, which is kind of like our little hub there, we make up, what did we figure? 33% of the state's drug deaths. So Monmouth County being 180, that's a lot. Middlesex 220, you have Atlantic County at 216. So it's not a problem that should be ignored. And we're in a pandemic with COVID, but the pandemic of drug use never stopped. It just isn't trending right now for some reason, but people are still dying, and there's new problems. Maybe it's not heroin that's trending right now, but fentanyl is killing a lot of people, even law enforcement. I mean, it's out there, and the pandemic has changed things, whereas people are able to order drugs on the internet. So we were going to talk a lot about that tonight and what's happening with, edibles and our young kids that are, getting marijuana gummy bears, but they're laced with fentanyl from the internet. So it's not something that should be, parents need to be aware. So education obviously is key. So those are the drug death numbers that we have. And, being that CFC started from a grassroots spot, I was just a mom trying to save my son's life. And we always said to each other, it'll just be one life at a time. Like, we weren't going, I didn't even know how to set up a nonprofit. I didn't know the first thing about it. And we were just action, let's just take action, bring the kids to the kitchen table, and let's just start this. And that is how it started. I can't express that enough, because there's days when the people that I work with, I go, I don't know, what do you think we should do? I don't know, what do you think we should? So it's really, I call it the disease of exceptions. And I call it that because it can't be treated like other diseases. It's an all-encompassing thing. You can't fix addiction without helping the family understand it. You can't send somebody that has addiction. It's not like breaking your leg and going to get a cast. When you go to treatment, you're not done. It's only the beginning of a lifestyle change that's going to affect every person within a degree of you. So if you are a recovering addict and you have a baby, that's going to change your family dynamic. You need to respect that you're in recovery. So we've come so far from the kitchen table. And I just wanted to say that it's, that's how things start. People that take action. So, and that's what all you lovely ladies coming here, and you're taking action by just listening and spreading the word. So thank you.
I think it's important to look at, what does addiction look like, and what is it? And I think a lot of, you have the stigma of that stereotypical picture of someone in an alleyway, on when they
from desk,
Skid Row, that kind of tent city kind of person, right? And that's not what addiction looks like. Addiction comes in many forms, and it's not just someone who's using every day alcohol or heroin or whatever. It could be someone that's binge using. The real facet is someone that, their life is becoming unmanageable. And like we stated, we're seeing more and more of this happening, especially since the pandemic, because the responsibilities of individuals have changed. People don't have to get up and, you know, they don't even have to put pants on. All they have to do is show up in front of a camera, and there's a disconnect there. And the opposite of addiction is connection. And all we've done in the last 2 years as a society is learn how to disconnect and still function. And it's led a lot of people that have never had any addiction issues to alcoholism and addiction with substances, just for the sheer fact of being isolated, having that disconnect, not having, you know, what they lived for is no longer there. They don't have to be as present, as accountable, and they find themselves in turmoil, and it creates its own trauma. And its own root issue to where it exacerbates into substances. And if you want to show the Jellinek curve that I have, I think it's a great, this is a great tool that was created, kind of a visual, to see what it looks like, someone that's going down, you know, going towards addiction, creating an issue in their life. And what I love about this is it really breaks it into phases. And as you can see, it's a curve, right? We start at the left-hand side, and that is called the early stage. So you could break this left line into thirds, right? And that early stage of addiction, what does that look like? Occasional relief from drinking or using, right? You start using substances to relieve yourself of whatever ailment that you come up with, whether that's social anxiety, stress, whatever it is. You go, I'm going to have a drink today because of this, right? Then you start going down that. You see onset of memory blackouts. I don't remember what happened last night. Unable to discuss a problem. I don't want to talk about it. That denial that kind of exacerbates. So those are all early symptoms of someone that's heading towards addiction, right? And then we go into the crucial stage, which is the middle part of that left side. And obviously the symptoms, the behaviors become more exacerbated. And then at the tail end, at the bottom of there is the chronic phase, which is where someone is completely morally deteriorated, onset of lengthy intoxications, impaired thinking, indefinable fears. And you'll notice that when you read these different things, there's nothing about someone who's drinking every day, or it doesn't talk about how much or how often. It's talking about behaviors associated with addiction. And I think it's important to realize that. And I think that's a big part of education, because the biggest thing that we talk about families, one, they'll call us and be like, you know, I really don't like what's going on with Johnny. And then they'll describe this whole situation that's going on. And we can look at it and we can pinpoint, if you're looking at the Jellinek curve, oh, you're hitting, you know, 17 out of 30 points here that there's a problem. And they go, you know what, you know, it's just a phase. You know, it's like they're reaching out for help, but they're also still not ready to really understand or want to make that issue a realization, right? They're still in that denial stage. And it's important for anybody to be educated to look at these points, whether it's a friend or a family member, to go, hey, you know, I'm noticing these things happening. What's going on? Let's talk about it. And early intervention is key. You don't have to go to chronic phase to find recovery. You could stop this at the early phase, which is a part of what we want to do at CFC. Mm-hmm. And what does that look like? Well, you know, there's different parts of someone's recovery, right? And different treatment silos that we end up in, right? So everything starts with an intervention, whether that's coming from a friend, a family member, or a professional that's intervening that person and motivating them to make a change in their life, right? So it's that external motivator to get that person to make a realization, hey, I want to make a change in my life. From there, there's different treatments that they can be a part of. There's detoxification, which is for someone that needs medical stabilization from their use. And from detox, they move to residential, which is a highly supervised treatment stay, to a partial care, which is an outpatient basis. It could have a residential component to it, but it's outpatient full day, full week of treatment. Then it moves to an IOP and then OP.
Then it moves to us.
Then it moves to us.
Yes.
Then it's us.
So when we talk about transitional programming, mm-hmm. The needs assessment even states this on page 56, where they say we need more transitional programs that are longer term to prevent the likelihood of relapse. It also says it is difficult for people to maintain their sobriety when they don't have the stability of a transitional program. So other programs are seeing the need. And what we mean by a transitional program, which is exactly what CFC is the program that builds the bridge from clinical treatment into the real world. It's the program that helps people learn how to socialize in a sober setting, or offers them a sober setting to socialize, and then teaches them how to make friends in recovery and be able to socialize in a real life environment, which is very important. Our CFC members have to go to weddings. They have to go, they're going to be toasting at the wedding. What do I do with that champagne and when I'm sober, 4 years? The little life nuances that that can't be covered in a clinical setting. And Dan and I were talking about this and the lack of the difference between case management and transitional programming and the therapy in general, or a clinical setting. Mm-hmm. And it's very different. So the needs assessment is seeing this, and now everybody's trying to figure out how to make more transitional programming that is monitored, that we can keep data on. We do this because of the Impact 100 grant. That grant launched us into our B Corps grant, which is a federal grant. And that federal grant mandated very specific data collection, and has taken the data collection that we've already created, and they're making it a model for data collection in transitional programming, which is really amazing. The same thing is happening with we are in Hackensack Meridian Hospital. We are their crisis team for recovery, for their certified peer recovery specialists. And we're in that hospital 365 days a year, every day. And we're on call every day. So the data collected from that partnership is immense, and it allows us to clearly see deficiencies and disparities in the system of Medicaid, people with Medicaid, uninsured, people with no insurance, different, how a hospital or hospitals deal with different crisis situations, depending on how full they are, if they're, during a pandemic. And it's quite interesting to see.
Yeah. Lynn, let me ask you this, because I think that was such a good overview. And I think one of the biggest takeaways is its behavior, right? So many people, talk during the pandemic. How many glasses of wine did you drink tonight? You talk about edibles, things we would never think of, that would fully lead to substance abuse. So that a really important point. Talk to us a little bit about how nonprofits, obviously like yourself, and you talked about Hackensack Meridian, how do you coordinate with the county, with the state, and just Monmouth County as a whole? Are there a lot of treatment facilities? Does Monmouth County have enough services? We talked a little bit about this before the call.
Yeah, as a county, we have a lot of resources. I think there's a lot of different nonprofit organizations and private organizations. We in Monmouth County have actually the least amount of treatment centers, like per capita, compared to other like Ocean County or Mercer County. There's a lot more available treatment. But in terms of nonprofits, we also have our fair share number here.
Can I just add something?
Yes.
What's really interesting about people that are going to treatment, hold your thought because you have to finish it, is that most people will never, more than likely, not go to treatment where they live. Mm-hmm. And it's really important sometimes that they don't. And that primarily being because they can AMA so easily and their friend can come by and pick them up from any of those treatment centers. So that's just something that we're always very conscious of, right?
Yeah,
Yeah.
I mean that there's a factor that plays in that, and there's also the other factor of like, yes, on a higher level of care, that's very important. Maybe, people, places, things get away from them. But when we're talking about ancillary services, when we're talking about outpatient, intensive outpatient, stuff of that nature, which you want to be by your support system. You want to be, I came back home after my treatment center, and it was why I'm here today, because I had my mom supporting me in that early recovery stages, which I needed. The issue is that a lot of people, they want to come back home, but there's no resources where they live. We run into this issue all the time, although we're very accessible, and we actually have 3 locations now for CFC. We still run into the issue with the person that doesn't have a car. I mean, most people have lost their license, all those kinds of things. But to get back to the question about what the resources in Monmouth County is, the biggest issue is the amount of man work that it takes to help a person. To really case manage somebody in their early stages of recovery into long-term recovery, there's a lot of life obstacles that we need to get over, and it gets more complicated as unique as the person is, right? If you have, mommy and me type populations, right, where you have a single mother that has a child, that's a lot more difficult. There's a lot less services. We need a lot more mommy and me programs in Monmouth County. They're few and far between, and the wait lists are 8 months long. You have people that have actual medical issues, no insurance, different things that come up all the time. And as a case manager, it's very difficult to keep up with that. You're not just meeting with the individual, but you're also making all these phone calls to all these different places. And any kind of, resources, like Section 8 housing or food stamps or anything like that, it's not something that you call up, send an application, and get something in the mail. It's not that simple. It takes weeks, months, to curate those things for somebody. And meanwhile, they're homeless, they don't have anything to eat, they're struggling, and you're trying to keep them sober and still do all this case management. So the funding is really important, because it's not funding that's going into, anybody's pocket, but it's trying to pay for the manpower to help these individuals. And there's just simply not enough. So a lot of these resources, I think a lot of them start out with good intentions, but we find that we have to narrow our scope all the time, because it's just too much to take on, and it's difficult. So yes, we have a lot of resources, but we're all in our own silos, and there's just simply not enough manpower.
To kind of build on that, and you touched, Lynn, quickly on COVID-19, but we've seen social isolation, we've seen more anxiety. How has that affected? Is there a lot of relapse? Do you think there's a lot of new people with substance abuse issues? What have you seen?
Yeah, so I mean, we had a 33% increase or a 30% increase in overdose deaths during COVID. So that kind of explains how terrible COVID has been to people relapsing. And relapse kills. You have somebody who's 2 years sober, you have somebody who's 6 months sober, and they pick up where they left off, and their body is just not ready for it, and they overdose, and it's very tragic. So COVID has done a lot. COVID has created isolation, and isolation is the devil's lair to addiction. And, he just keeps singing, and then we have Zooming and the web and social media and Snapchat and all of these. So these media outlets that's where the drug dealers are selling their drugs. So we thought, right, I said to you, Dan was worried about the drug supply. He's like, when COVID hits, the drug supply is going to diminish, and we're going to have people going crazy looking for drugs. And remember the argument, they left the liquor stores open, like it became an essential service. Because it actually was an essential service, right? So at least they knew to do that. But so
it went the opposite though. What happened was, if you realize, like, cryptocurrency and all those things have gone through the roof, right? Mm-hmm. Bitcoin has quadrupled in its value, and part of that is all these different sites came about that you can trade these cryptocurrencies very easily. It's very easy. Like, before, you needed all these different, like, you need to know how to code computers in order to transfer Bitcoin, but it became very accessible in an app on your phone. And that was a drug dealer's dream. because all of a sudden everybody can just take out their debit card, transfer it into Bitcoin and one little button and buy whatever you want on the web.
And a parent's worst nightmare.
So, and it comes right to your door. It's secretive packaging. You think, they bought gummy bears from Amazon and it's not, and so you see this, it went the complete opposite way. People were able to get more drugs and more powerful drugs. You see a whole new slew of designer drugs coming to the market. We have all this fake Xanax going out that it's designer made. It's made in a laboratory. It is not Xanax. It's 10 times more powerful than Xanax, and people are losing their minds on it.
But it looks like Xanax.
Yeah, the drug trends are changing for sure. I think all the publicity about overdoses has scared people. We've seen a rise in them because those are the heroin addicts that were already existing that were getting fentanyl all of a sudden, and then they were overdosing. But I run a treatment center. We're seeing a completely different slew of drugs come in. Alcohol is on the rise, and methamphetamine is, I would say 50% of my clients are now addicted to methamphetamine, where 80% used to be opiates a year ago.
And we're also seeing age differences. So we're seeing older people coming in. So even our demographic was mostly, like, I would say 5 years ago, well, I would say 2 years ago, 3 years ago, was 18 to 27. Now we're looking at like 35 to 45. So when they're coming in with bigger life problems because more life damage has been done, right? So
for professionals, they have a job, they lost a lot more than the 18-year-old that comes in that really didn't start life to lose it. Most of these individuals had professional
marriages,
jobs,
children, careers. So they have such a big rebuild. And it changes, the psyche changes. I lost so much. How am I ever going to, when a mom comes in and lost custody of her children, like what's left to live for, so it's a very different client base right now. Drugs they're just much more serious. It's changing. It's just ever changing. It's never going to go away, and it's ever changing. Yeah.
Right. And like you said, just hard to build back. Talk a little bit about how substance abuse affects the community at large, or just affects in general, maybe Monmouth County.
Okay. I'm going to do that one.
I mean, substance use affects all levels. It affects us from, everybody probably realized their health insurance rates have skyrocketed. That's all due to the substance abuse treatment that was mandated in 2008 by Obama. He put in there that you have to give mental health and addiction treatment. And it took 5 years for insurance companies to realize, like, oh, we got a problem. And they raised all our rates. So it affects, living expenses for everyone. It affects housing, and it affects property values. It affects crime rates, hospitalizations. Our hospitals right now, it's, they're locking down COVID floors. They have nurses on strike. They have floors of hospitals that are just abandoned because they don't have enough people to work them. And meanwhile, the overdose rate is going up at the same time. So their emergency clinics are shut down from COVID, and they're trying to get people in there with overdose issues. And people are frustrated. So, they're tossing them out in an hour or half an hour.
Well, the stigma that we stopped, the stigma that we really did a lot of work on in the ER was treat somebody with an addiction issue the same you would treat somebody with cancer that's coming in here. And with COVID, overwhelming the system and the staff shortage, when the person that comes in with that drug overdose is like, the hospitals are doing great. I don't want to say they're not doing great, but that is something that, again, that stigma plays.
It's not important.
It's not as important. It was almost,
ER.
Yeah, get them out of here. They're taking up a bed, and we have real sick people.
So that's going on, and with all these overdoses, especially with a 30% increase, we have more and more families, Child Protective Services are overloaded. They can't handle the amount of kids that don't have parents anymore. You have grandparents raising grandchildren left and right that don't even know how to sign on to Zoom for their kids for school. So it really affects every node of society. And that's what takes so much to start solving these things. At CFC, we focus on the individual, the family, and the community. So we're trying to do all these different, create all these different solutions for all these different problems. And we need help. We need help, and we need more manpower to do so.
Absolutely. We need, I think, a lot more in this community and across, the world, really, when it comes to substance abuse. Let's talk a little bit about how CFC has evolved, right? In 2018, something that we learned through our application process is that a lot of nonprofits that aid just in addressing substance abuse actually have difficulty getting contributions, getting supporters. Where are you 3 years later, and is that still the case?
Yeah. So, so how have we evolved? First of all, Daniel is going on 11 years clean and sober. So that's a big yay. Yeah. And he's blessed me with 2 beautiful grandchildren. So yeah, so that's another thing. Yeah. So evolved, if that was my first mission, I'm like mission accomplished, I feel. I'm very proud. Thanks, yeah, so just thought I'd mom you right there. But how have we evolved? I mean, the grant from Impact 100, like I said, created amazing programs, some of which got dislodged with COVID because we had to Zoom a lot. Right now, even our family group as a whole, Sue Evans is on here, and she's our family coordinator, and she's been holding our family group virtually. Just because we had some quarantining going on and all of that. But how have we, I mean, it has launched us into the B Corps grant, the ability to apply for that grant and feel confident enough really to get that grant. And that grant came with a lot of responsibilities. It allowed us to expand to 2 more sites. So we're in Ocean County and Toms River, and we're in Matawan, which is still Monmouth County, and we're in Howell. So we're able to service more people. We have coordinators in both of those locations that are doing phenomenal work. Our Toms River place is really taking off on a holistic kind of vibe, and we have meditation. We had a drum circle there last weekend. We have Soulful Sunday there now, and that's Carol Mason, and she's doing great. So we're constantly changing with the tides. Our meetings change with the vibe of what's going on, and we're very confident in doing that and making those changes and listening to the members and the families within CFC for what change they want to happen. We've visited Washington, D.C., fighting the fentanyl crisis and all of the drugs coming out of China and over the Mexican border. And we had that Lost Voices of Fentanyl. You could go on their Facebook page. Derek Schultz who is a federal DEA agent in Washington. He spoke at Rock the Farm, our big fundraiser, at the end of the summer every year, September. So we went there to kind of pound on desks and meet the families of children that were lost. Seriously, with only taking a drug one time, like not having a drug issue and just being at a party and, hey, take this, and gone. And these parents are absolute devastation. And that's fentanyl. What else have we done? Oh, so the B Corps grant allowed us to also enter into, we worked very hard on the Hackensack Meridian contract to get in there as their crisis unit. At that time, we were also the crisis intervention team for Long Branch, Asbury Park, and Howell's Police Department. And then we found that those services, they were taking those services directly into the hospital. So we worked very hard with Dr. Joe Miller, who recently passed in the middle of this project, but We are in the hospital, and we're on the second year. They renewed for the second year. So that's going fabulously. So yeah, it's been crazy, but
So you've had nothing to do.
yeah, nothing to do. Yeah. So, but we are always, like Dan says, case management is huge. The other thing that we've done is really launched our academy. We are on the New Jersey Cert Board Academy for recovery coaches and certified peer recovery specialists. So we host those trainings quarterly usually. And so we're also the CPRS internship. So we're able to sign off on the hourly requirement for that certification, which is huge because those CPRSs then become our case managers and the hospital's case managers. So it's really this fabulous rotation of it's our members come in, they get clean, they come in clean and sober, but white knuckling, and then they learn how to kind of live in recovery and they get confident. I think we've had 3 marriages, 5 CFC babies. Yeah, so it's like, and we're just part of their family now. And it's really, Sue's son got married, and Linda, she's on here, her daughter got married. So like big things, big changes. And, when Dan and I said one life at a time, it seriously is one life at a time, but we're up to the 10,000, 15,000 people.
Yes,
also opened a treatment center in between all this as well.
Yeah, and Daniel opened a treatment center. He launched out of CFC and he opened a treatment center, and he left me running CFC. Yeah. And his wife. And his wife is in here somewhere. Yeah.
So you talk one person at a time, and I just have one more question because we do want to open it up to other people. Call, 10 years, right? You've been doing amazing work, and the numbers we know are mind-boggling. Just talk a little bit about the magnitude of how many people you've supported, whether it's families or, individual people that have kind of come through.
So the magnitude, I don't know how to, I don't know how to measure it sometimes. The ripple effect of one life is so immense, right? So, if Daniel, my son, didn't make it, I wouldn't have grandchildren. I wouldn't, some of the people on this call, I wouldn't know any of you. So I don't even know, I don't know how to measure that. I can give you my measurements as to who comes in and signs an intake form, and then who leaves in a month and who leaves 4 years from now. I could give you all that data. But that doesn't account for that person's family and grandparents and the children. All I can say is that CFC, our philosophy is one life at a time, and to do no harm. And that's what we try to do. And it works. And it just works to take action, to not be afraid, and to help your neighbor. And if there's such stigma, there's different types of stigma. When you're in a higher, more affluent area, people are afraid to say to their neighbor, "Oh, something might be wrong." But if you got to say it, you just have to. Let me help you. So our numbers are terrific and horrific at the same time. Yeah.
A lot of sense. I'm going to let you take a sip of water. I'm going to talk about impact for 2 minutes, and then we're going to row to ask some questions. And again, throw them in the chat when you get a chance. But what I briefly want to touch on is for those of you that aren't as familiar with impact, we are women of different ages and backgrounds who combined our charitable dollars, our experience, and our energy to make a tangible difference. Right now, Impact 100 is a global movement. There are over 60 impacts globally, 3 continents, given away, awarded over $100 million. And it's just a phenomenal organization to be a part of. And there's actually 4 impacts right here in New Jersey. And so Impact 100 Jersey Coast has awarded over $2 million in grants to 18 high impact projects. And we're just so proud of that. If you take a look at our model, each woman donates $1,100 and $1,000 automatically gets pooled into our grant fund. So our local nonprofits will submit their applications for high impact projects. And then members of our committees will review the applications, perform site visits, and ultimately pick the finalists to come to what we call our annual meeting. And at the annual meeting, the finalists will present, and that's when we will be able to award the amount that we raised that year. So just to kind of put some numbers on this, this past year, we had 430 women, and we were able to award $430,000 divided by 4 finalists just recently in November. So right now we are in the middle of our grant season. So we are looking for members to join, and then we will work on getting our applications out to the nonprofits. I think something that makes us unique and is very different is the way we make our grants. I think the power of one multiplied by many is a perfect statement. My $1,000 truly felt like $430,000 back in November, and I feel that way every year. And it's just amazing to be a part of that collective giving. When we do fund specific projects or programs at the different nonprofits, there's 3 things that we're looking for. We wanted to target an underserved population. We're looking to highlight some type of an unmet need in our community, or obviously have a high impact on the beneficiaries. So how can you join Impact? As I said, our membership drive is open through March 15th, and there's really 3 ways to join. You can obviously donate the $1,100 before March 15th right on our website. You can also enroll in our installments plan. We're getting pretty close to the March deadline. So obviously I apologize, it's past January 15th here, but it would be 2 payments of $550 each. And then lastly, we absolutely give scholarships every year. Our scholarship program is up and running on our website, and you can apply there for a scholarship. Lastly, we have one more education series coming up on February 1st about behavioral health services for adults. So we'd love to see you there. And lastly, I just wanted Lynn and Daniel to touch on 2 pretty big events coming up for CFC so that everybody could take a look at it. And we also will post and send out the flyers that give you a little bit more information. So I'll turn it back to you, Lynn, if you want to talk about the events.
Thank you. And I'm going to become a member. So that's yay. It's always fun. Okay, so yeah, we have 2 events coming up. Again, very, very important for us. We have the Victorian Tea Party at the Mathis House. We hold it down in Toms River. I don't know if anybody's been there, but it's so cute and so quaint. And it's for our women's empowerment group. So all funds go to help our ladies in different, there's a couple different sponsorship opportunities. That it's not listed per se on our website, but I did forward over to Lori the actual links if you wanted to buy tickets. We were just having some technical difficulties tonight with the website. The other event that's extremely important, and I spoke to Sue Kiley actually Monday about this. So ACTS and Monmouth, all of Monmouth County's resources will also be present. We paint them all purple. Purple is CFC's color. It's also a healing color because it's the amethyst stone. That's why everything we do is purple. Plus we like to stand out and be really loud about our recovery. But paint them all purple at Freehold Mall on May 1st. We drape the whole mall. We decorate it. So if anybody is good at tying bows and wants to come volunteer, we would love it. So we drape the whole mall in purple, and we have presentations all throughout the day. But we invite over 150 vendors. We supply the table. It's free. And all of the resources of Monmouth County and Ocean County, some come up from Ocean County, and they'll be on display there. So all the family, anybody from the community can come and get any information on any resource in the county at that event. and that will be May 1st. And we do that just as a community outreach.
That sounds great. Paint them all purple. I love that.
Yeah.
All right. I think what I'll do now, turn it over to Ro. Anything in the chat, or if anybody would like to come off mute, let us know, and we'd love to hear questions.
Thanks, Laurie. Good evening, everybody. And thank you, Daniel. Thank you, Lynn, so very much. And congratulations on all you've accomplished, even since you were an impact grantee. It's just phenomenal. So thank you for all you're doing. And I'll very much try to get to the Victorian Tea Party, because if there's anything that I love, it's an English tea. Yeah. I have two questions. One from Kate Ryan at Habcore. Hi, Kate. Thanks for joining us. And that is, do you distinguish between substance abuse and addiction?
Absolutely. I think it's important to. Just like it's important, we distinguish between the lapse and relapse. It's important not to create a label that everybody falls into, because everybody has to be treated in a different way. Especially like the parent that's coming in with, the 16, 17-year-old that keeps getting caught smoking weed. It's important to utilize the right services for that person, that they probably don't fall into someone that's in addiction. And the issue is, a lot of times the parents can call a resource and they instantly want to get that kid into treatment, whatever it may be. And that's not necessarily the right thing. You exacerbate an issue that doesn't need to be exacerbated. There's a certain way to handle everybody where they're at. So yes, we absolutely distinguish between substance abuse and addiction.
Thank you. Two questions from Mary Riley from Impact. Can you comment on the view that substance abuse and or addiction is a choice people make?
Absolutely. I mean, any behavior, it starts with a choice, right? I mean, we choose to behave and do things on a daily basis. It's just what clouds that choice from being clear or rational. That's what we have to look at. And when we're looking at different individuals with maybe a corrupted belief system or trauma or anything in their background, well, how can we expect that person to make the right choice? And that's really the underlying issue. Right? That's the root causes of someone that's behaving in a way that's maybe not socially acceptable or dangerous. And it doesn't just hold to substances. You look at individuals with mental health, right? And they have behaviors that are not socially acceptable. They might be rude, they might be dangerous, whatever it may be, but do we blame them for making those choices, right? We can't, because there's an underlying issue there, right? And we need to create a solution. So we have to get away from that, oh, they made a choice to do that. Yes, but why did that happen? And that's what we do at CFC. We're trying to take that person and solve, hey, why do we keep making these choices, and change that whole perspective, that dynamic of their belief system from irrational to rational.
And one more is, in addition to the events, how can people help CFC in your mission?
So many ways. You can start by being good neighbors. You can help us volunteer, be volunteers for us. You can sign up on our website. We need volunteers. We need to drape the mall in purple in the month of April, so that would be super helpful. We also need volunteers for Rock the Farm in September. That we have 104 volunteer spots that have to be filled. Our volunteers run that entire event. There's no paid staff at that event whatsoever, which is absolutely remarkable. We had over probably 7,000 people, 7,200 people. We sold 8,700 tickets for that event last year, and probably 7,200 showed up because of COVID. I think, some people bought them and then didn't come, but it was hugely successful, but we need volunteers for that. We also could use volunteer social workers to help us with some case management at our members' meetings. That would be super helpful. Monetary donations are more than super helpful and necessary. And in-kind donations are very much needed. We need pillows, we need cleaning supplies, we need paper goods for our recovery houses, and coffee for our group meeting spaces.
Starter kits for the houses. A lot of people come in, they don't have a toothbrush and the normal
soap, toothbrush, razor,
toiletries and whatnot.
Yeah.
Well, thank you so much. I think this was such a great event, our third education series coming to a close, but thanks for sharing your story. So much education. I know I learned so much. And congratulations on all the success you have. We know that you're going to continue to help, tons and tons of people. Impact is always your family. So thank you for supporting us. And we'd love to have you as a member, Lynn. And lastly, for anyone on the call, remember, if you're a 2021 member, please renew for 2022. And if you have not joined, we'd love to have you. As we always like to say, the more members we have, the more grants we can make and the more lives we will save together. And thank you again. And hopefully we'll see some of you on February 1st for our fourth and final education series. Thank you so much, everybody.
Thank you.
Thank you.
Thanks for joining. Thanks, Laurie.
Thanks, Ro.